Welcome to this patient information video on MRSA. What is MRSA? MRSA, which stands for methicillin-resistant Staphylococcus aureus, is a common germ that lives completely harmlessly on the skin or in the nose of about 1 in 3 people. MRSA is a type of bacteria that has become resistant to a number of different antibiotics. How can you get MRSA? The people most at risk of getting MRSA are those who have been in hospital for a long time, or have a long-term illness, or have had a lot of antibiotics. People who are sick in hospitals with drips, drains, open wounds, etc. are at risk as well. In the hospital, MRSA may be passed from one person to another on the hands of staff or visitors, by patient care equipment, or by contamination of the hospital environment. Is MRSA dangerous? Most people who carry MRSA on their bodies or in their noses, which is called colonization, don't suffer any ill effects. However, MRSA sometimes causes infections if it enters the body. Most MRSA infections are called local infections, such as boils, abscesses, or infected wounds. These are easily treated. In a small number of people, however, MRSA can cause serious infections such as septicemia, also known as bloodstream infection or blood poisoning. How can you tell if someone has MRSA? MRSA may be found in clinical specimens sent to laboratory or through targeted routine screening of blood, urine, nose, any wound or any other part of the body. What happens if I get MRSA? Patients in hospital who are carrying MRSA may be cared for in a single room on their own. Can MRSA be treated? Patients who are carrying MRSA may be given antiseptic body and hair wash or powder and an antiseptic cream for their nose to try and get rid of the germ. Extra swabs may be taken from the nose and other parts of the body after this treatment to see if MRSA is still present. If a person has an infection caused by MRSA, they are treated with antibiotics, usually given intravenously, that is, by a drip. Will I have to stay in hospital for longer? Most patients who are colonized with MRSA do not usually have a longer stay in hospital, but if you have an infection, you may have to stay in hospital until it shows signs of clearing up. Can I have visitors in the hospital? Yes. MRSA does not normally harm healthy people, including pregnant women, children, and babies. However, visitors should ensure that they clean their hands with soap and water or hand sanitizer before and after visiting and should not use the equipment or sit on the bed. Please note that hospitals do not recommend babies and young children to visit MRSA patients. Will I need treatment at home? You might need to continue using treatments at home following a hospital stay. If I am in a single room with special instructions on the door, can I go for a walk? Yes, but do wash your hands or clean your hands with a hand rub at the door before going for the walk and upon returning to your room. How is MRSA and other healthcare acquired infections prevented? Good basic hygiene measures are extremely important. These measures include: when washing hands or applying hand cleaning rub, be careful fingertips and thumbs in the process. Remind staff to wash or clean their hands before touching your drips, drains, dressings, etc. if you think they have not done so. Do not share any other patient's personal hygiene items, beds, etc. Wash your hands after using the toilet. Visitors should apply an alcohol hand cleansing rub to their hands on entering or leaving the wards. Thank you for watching this video on MRSA. Please feel free to share its contents with family and friends.